In this module, we will be talking about caring in nursing. What is caring behavior? How is it demonstrated? How is it perceived by those who are receiving the care? Before you go into this module, please make sure that you complete the pre-assignment of watching in society or in the community where you see behaviors that would indicate caring. Caring relationships can take on a number of different forms that we will see. You probably saw those in the community when you went and did your observations, or maybe you have experienced this in your own life. Compassionate caring relationships are those that are based on one person who is giving care to another person in need. The caregiver is able to exhibit empathy for the person that they are caring for. A nurturing relationship would be like a parenting relationship where the caregiver is giving care to the recipient, but in hopes of maybe receiving care back at one point, or in the case of parenting, you're trying to develop somebody who is going to become a member of society. So it is, although it is a caregiving role, it is with the potential for there being reciprocation. Pity would be the kind of relationship where the caregiver sees the care recipient as downtrodden, or they're down because of the result of some of their behaviors or their circumstances. Very often pity is seen as sort of a superior position, to look down on someone else, and it is not one that is a growth mindset. There's not a way for that care recipient, when they are being the recipient of pity, for them to be able to feel the self-efficacy or the ability to come out of their circumstances. A symbiotic or reciprocal relationship is one where the caregiver and the care receiver are on a very equal term. Sometimes the caregiver is the care recipient, and sometimes they're, the caregiver. So this is a more egalitarian relationship, and very often you'll see this in maybe a sibling or a spouse or a significant other, etc. Caring relationships can also have a narcissistic bend to them. The caregiver can feel that they are the hero, that they are needed and necessary. Again, this can be a relationship that can be detrimental to the care recipient, because the caregiver is going to make the relationship about the care that they're giving. So that care recipient is never going to quite be able to stand on their own without the help of the caregiver. Caring in nursing is seen in a number of different ways. Servant leadership is a term that actually you will hear again when we talk about Jesuit, but it is the idea of leading and caring for another by way of humility and by seeing the gifts and the values that that person brings to the relationship. So it is not necessarily going to another and saying, I know how to fix you, but it is going to another and saying, how can I help you with your gifts to bring you forward? Cura personalis is another term that you'll hear when we talk about Jesuit. Cura personalis is the idea of caring for the whole individual. So again, when we look at health and health care, oftentimes we will be healing from an illness or a trauma, but cura personalis looks at the whole person. What about this person could have impacted their health, could have impacted their behavior? And so we will be talking about this again as the semester progresses. Jean Watson is a nurse theorist. She has created the grand theory of human caring. Human caring is a very large theory that is created and composed of the 10 caritas, which are the core values of the theory. You can see those off to the right of the slide. You will probably hear more about Gene Watson's theory as you progress along in your program, so we won't go into it too much right now. Christina Swanson was is a theorist as well, who created a middle level theory on caring. This is a way to bring it's an application of a grand theory, such as Watson's, to practice. So hers is a little bit more applicable to the day-to-day nursing care. As you may already be aware of, and you will learn more about as your program progresses, there are a number of different roles that the nurse can possess. Some of these are going to have more obvious demonstrations of caring, such as the registered nurse in a hospital who will provide hands-on care for a patient, but even some of the other roles that may not be as one-on-one will also be demonstrating care. The nurse practitioner, for instance, is going to have a long-term historical relationship with that patient, and they can provide care and demonstrate care by understanding and learning more about the experiences of the patient and how that impacts them as they progress along in their health. Even the public health nurse, perhaps working within a community, will be demonstrating caring behavior by taking data and policies and resources and bringing it to the community so that that community can flourish. And lastly, the nurse faculty, who very often, instead of caring for patients, may be caring for students. And again, the caring behavior is demonstrated in a way to bring students forward as they are progressing along through their program. This is the American Nurses Association definition of what nursing is. And although the word care only appears once and seems to be of a physical nature, all the other duties assigned to the nurse stem from caring. As you are watching the American Nurse documentary, notice where you see caring behavior. Each one of these nurses is very unique in the setting in which they provide their care, and each one provides it in a different, unique way. Also look and see what brought these nurses to the profession. Most people say that they came to the profession of nursing because they wanted to care. How was this exhibited? And also pay attention to how these nurses find fulfillment in their profession. It is very important to be fulfilled in the profession itself in order for you to be able to provide care.